down from 798 people just the day before. 151 are in intensive care and 94 are on a ventilator. They are both reductions from yesterday. Approximately 90% of those in hospital, and 90% of those in hospital and 97% of those in intensive care were not fully vaccinated. Nothing tells the story of the power and the protection of vaccination more than those stats. And they're not numbers, they're people that are very, very unwell, some of whom are gravely unwell, gasping for air. They are not vaccinated, not fully vaccinated, almost all of them. So there's every reason to go and get vaccinated, just like so many millions of Victorians already have. There were 73,501 tests processed yesterday and 38,977 vaccines were administered at our state hubs, bringing the total number of Victorians with at least one dose of the vaccine to more than 5 million. That is quite an amazing achievement. 89% of the population over the age of 16 have now had a first dose of the vaccine, and some 65.5% have a second dose and are fully protected. This is an amazing achievement. Some time ago we asked Victorians to get vaccinated, and they have, in record numbers and in record time, done exactly what we asked them to do. I could not be more proud of our community coming forward, making these decisions to protect themselves, to protect the people they love, and to protect all of us against this global pandemic, to allow us to change the rules, to open up, to normalise this, to get our freedoms back, to be focused on living our lives as close to normal as possible. Today is the day to congratulate and thank every single one of those 5 million Victorians who have at least got one dose. Of course, there is more to do. We've got to get to that 70% double dose threshold. We've got to push beyond that and get to 80%. Pleasingly, we are predicted to either tomorrow or Tuesday to pass through the 90% first dose barrier, which is a mighty effort and something that makes us very, very proud. Now, we've always said along the way that if we saw vaccination uptake faster and in greater numbers than we had predicted, then we as a state, as an economy, a community, as a public health system, we would have, all of us, more options. That's why today I am very pleased to be able to announce that from 11:59 p.m. this Thursday, when we will hit the 70% mark, the lockdown lifts. There will be no restrictions on leaving your home. There will be no curfew. The roadmap will be delivered in full, and here are a number of things we are adding to the roadmap as of 11:59 p.m. this Thursday. Things that we can bring forward, additional things, extra things that we can do because the Victorian community has done so well in getting vaccinated so fast and in such great numbers. There will be no travel limit within metropolitan Melbourne. So we had proposed a 25-kilometre limit. There will be no limit for travel across Melbourne. However, unless you are authorised to enter regional Victoria, you cannot enter regional Victoria at this time. Visitors to the home. We had proposed no visitors to the home, but we are now, from 11:59 p.m. on Thursday night, 10 visitors, including dependents, will be able to visit your home per day. We believe that is appropriate. It is, however, highly recommended that only vaccinated people above 12 should be visiting you at your home, but that's not something that we can necessarily enforce. It's only advice that we can provide. Given that some 9 out of 10 people over the age of 16, and very soon 9 out of 10 over the age of 12, have at least one dose, will get their second dose, then that's going to account for the vast majority of Victorians in good time anyway. Public gatherings are at 10 at the moment. They will go to 15 people, including dependents. Again, vaccination has been mandatory because we were building to that 70% threshold. It is now highly recommended that a gathering of 15 people outside should only be those people who are vaccinated. It won't be mandatory, but again, it is the advice, it is the recommendation. That's what's safest. That's what we would like people to focus on. The staggered return of grade 3 to year 11 in metropolitan Melbourne will commence on Friday the 22nd of October, so it will be brought forward, commensurate with the fact that we are ending the lockdown earlier, because we've achieved our 70% double dose target fully 5 days earlier than we had predicted. For the hospitality sector, food and drink will be seated service, and 20 people who are fully vaccinated will be able to have that experience. They'll be able to eat and drink inside, plus the previously committed 50 people outside who are fully vaccinated. So it was 50 outside, it's now 50 outside and 20 inside. There will be density limits, but it is again something extra and something meaningful that we can do at this point. In terms of faith gatherings, there are similar changes there. Funerals and weddings, again, similar changes, adding to the settings that had been foreshadowed in the roadmap at 70%. Just quickly, in terms of regional Victoria, because for a little while longer, regional Victorian rules will be different to metropolitan Melbourne. I'll come back to their unification, if you like, and the standardisation of those rules in just a moment. But from 11:59 p.m. this Thursday evening, the 21st of October, these additional changes to the roadmap settings will apply in regional Victoria. Private gatherings, so 10 people including dependents, with vaccination for 12 plus highly recommended, so visitors to the home, 10. Public gatherings go to 20 people, including dependents. Outdoor settings, 100 people per venue, fully vaccinated. Indoor settings, 30 people fully vaccinated in restaurants, cafes, cinemas and gyms. And just like Melbourne, all students will be back on Friday, the 22nd of October. Now, in terms of what's next after this 70% double dose gateway, if you like, we are predicting that we will be able to get to 80% double dose on or about Melbourne Cup Day, could even be a few days before then. So these settings will be in place for that short period. At 80%, it is our intention to deliver the roadmap as has been outlined. And that is much bigger, much broader, much more significant change, because it's safe at 80%. There is a very significant difference in having 70% of the community fully protected and having 80% fully protected. Why have we been able to make these changes today? Well, as the Burnett modelling, which has been provided to all of you, and I think you've been briefed this morning on the contents of the Burnett modelling, we have more case numbers than we would like, but they are not converting into hospitalisations at quite the rate we thought they would. What's more, the length of stay in hospital is substantially less than we thought it would be. The acuity of illness is substantially less than we thought that it would be. All of those things are positive. Plus, of course, we've reached this 70% mark in record time, and at the same time as we're reaching 70% double dose, we're about to push through 90% single dose. That's quite an amazing achievement. Now, single dose is not the same as double, but it does provide a significant degree of protection. So it's meaningful when you get to that very, very high level, 9 out of 10 people over the age of 16, and pretty well 9 out of 10 people over the age of 12. That younger group, the 12, 13, 14 and 15-year-olds, are racing to get the jab, and they are hot on the heels of the rest of the community, even though they've only been recently added into the Commonwealth's vaccination program. So that's why it is safe for us to make these changes. And that's why, as we said, the more people get vaccinated, the more options we'll have to get back to normal, at least to find COVID normal, to do the things that we love the most, to be with the people that we love the most, but to do so safely, not putting more pressure on our nurses, not overwhelming our health system. In a cautionary note, the Burnett modelling also makes the point that if we were to rush and try and do all the opening up that we had foreshadowed at 80%, this Thursday midnight at 70%, then we would have an unsustainable number of people who would get really very, very sick. And that would put enormous pressure on our health system, our nurses, our doctors, our ambos, the whole team. And not just for COVID patients. And I know I've made this point many times, but I want to just remind people that the hospital system is busy on any day. Strokes, heart attacks, premature babies, cancer patients, people who have accidents. The hospital system is very busy. So if the place is full and overwhelmed by COVID patients, not only will some of them miss out, but all the other people who normally come to hospital because they need to, then the hospital system won't be there for them either. We have to try and avoid that. And look, it's not about machines and it's not about money. There's plenty of all of that. It's about people. And our nurses, our whole team, are very, very tired because they've had 18, 20 months like never before. So we have to be wise to that. We have to be respectful of our staff, and all of us have to play our part in not making their job any harder than it's already going to be. In the weeks and months ahead, we will see a peak in cases, and we will see a peak in the number of people who are in hospital. And we will see people lose their lives to this. That'll be a terrible tragedy. That'll be incredibly difficult for families, for loved ones, for staff in our health system. That's why getting vaccinated is so, so important. I can't tell you how proud I am of our state, the resilience, the courage, the compassion, and the conviction that Victorians have shown to get this job done is quite amazing. Not only am I proud, but I'm deeply grateful. But I would just say this, there's still a little way to go. We've got to get that 70 number to 80. So if you've got a second dose appointment out there, then you need to go and turn up for that second dose appointment. If you can bring your second dose appointment forward, then I would urge you to do that. If you haven't had a first dose yet, every dose matters. Even though we'll pass through these gateways in the next couple of weeks, vaccination's still incredibly important. And if we can get to 90 and 91 and 92 and 93%, as high as we can go, that'll be less people in hospital really, really sick. So there are appointments available. There have never been more appointments available for Moderna, for AstraZeneca, and of course for Pfizer, in state hubs, in GP clinics, and with our friends in community pharmacy. There are appointments available. If you haven't got vaccinated yet, please don't be one of those people that finishes up really, really unwell. As I said before, 97% of people that are on a ventilator, 97% of people who are in ICU have not been fully vaccinated. That's the only statistic that anyone needs to know. Having said that, they're not numbers, they're people who are gravely ill. Today is a great day. Today is a day where Victorians can be very proud of what they have achieved. But just as we have vaccinated in record numbers and in record time, all of us know that this is not over yet. There's still a little way to go. And we've just got to see this thing through, push on, push through, get vaccinated so that we can hit 80% and beyond, so that we can open up, normalise this, look forward to Christmas and the weeks ahead of Christmas, and indeed look forward to 2022 with a justified sense of hope and optimism. We do what we say. We said that if people got vaccinated, we would open up, we would deliver the roadmap, and if they got vaccinated in record numbers and in record time, we'd have more options. That's what today's all about. I am proud of Victorians, I am grateful to Victorians, and I'm absolutely confident that Victorians will finish this job off. I'm now going to ask the Chief Health Officer, and I want to thank Brett and his team and Martin Foley and his team for their work. It's not an easy thing to add to a roadmap that was quite settled, but we have these options because Victorians have done so well. Over to you, Professor Sutton.
Thank you, Premier, and good morning. So a little bit on the geography of our current cases. The southeastern suburbs, 612 cases today, about a third of our total. Now leading the region in Victoria, Casey local government area has recorded 251 new cases. So that is a standout in terms of local government areas. Vaccination rates increasing very significantly there, but from a pretty low base. And so that's why that vulnerability is reflected in the numbers. The western suburbs today, 527 cases or 29%. The northern suburbs, 449 cases or 24%. And the eastern suburbs, 101 cases or about 6%. In regional Victoria, 142 new cases, including with a total number of active cases of 1,604 or about 7% of all active cases. Of note, 33 in Greater Shepparton, two-thirds linked so far, 19 in Greater Geelong, 19 in Bawbaw, in both cases largely linked to existing cases or known exposure sites. 12 cases in Mildura, a reduction in over half, but there are still more than 200 active cases there. In terms of the vaccination, it's really been an extraordinary story. We've had huge uptick in our vaccination. We've gone from 0 to 35% coverage in over 150 days, and the 35% to the 70% mark is going to happen in much less than that. It's really extraordinary how we're shooting up the global rankings in terms of our vaccination coverage. It will make a huge difference to the size and complexity of our outbreak now. It doesn't seem like a lot to go from 90 to 95% first dose or beyond, but as the Premier says, it makes a huge difference. What those first doses will do will reduce your risk of hospitalisation and dying significantly. Getting that second dose reduces the risk of transmission really substantially and puts that downward pressure on our case numbers. That's a really important thing. And the number of people who remain completely unvaccinated to be reduced by half is hugely important. It doesn't seem like a big percentage. You know, we've got close to 95% or more for many of the age groups above 50 or 60 years of age now with their first dose. But to go higher is really important, because those people who remain completely unvaccinated do remain completely vulnerable to severe illness. A lot of people are reflecting on the fact that they're well and healthy normally, that they don't get severe colds, that they eat well, that they exercise, that they get sunshine, are not overweight. But many people with no pre-existing illness can get very severe disease. And the reality is many of us, almost half, have a pre-existing illness. And some of those pre-existing illnesses are only mild, but they do predispose us to really severe illness as well. A lot of Australians have asthma and respiratory illness and heart disease, kidney disease, and many other pre-existing conditions do put you at greater risk of severe illness. So it's hugely important to keep pushing that line that we need the highest possible vaccination coverage. I don't want people to be completely vulnerable to this significant illness, one that's 10 times more deadly than influenza. So those vaccination figures across many LGAs in Metro Melbourne and regional Victoria are really gratifying. Hume's reached 90% single dose coverage, and then Casey, Cardinia, Wyndham in particular, very high first dose coverage. They'll soon be joined by Melton and Frankston and many others. We've got 19 community and neighbourhood pop-ups in some of those areas today and through this week. I'll call out just a few. Mill Park Baps Temple in Whittlesea, Melbourne Demons at Casey Fields, East Reservoir Senior Citizens Centre in Darebin, Our Lady Guardian of Plants Chaldean Catholic Church in Campbellfield within Hume, and Faulkner Community Hall in Moreland. And it's a big week of neighbourhood mini-pops, as my team likes to call them, those little pop-up sites that happen in cafes and gyms and street corners. There'll be pop-ups, mini-pops running half a day at the Moroccan Soup Bar in North Fitzroy, Itiki Sporting Club in Glenroy, Degani in Craigieburn, and neighbourhood houses in Deer Park, Frankston and Rye. They get scores of people attending. Many of those haven't necessarily booked in for a second dose, see the mini-pops and are coming and getting vaccinated. So that's great. It's also a reminder that if you haven't made those bookings, please do. Getting that second dose is really critical. As the Premier said, Victorians have so much to be proud of today. We are racing through that 70% double dose mark to go to the 80% at record rates. Really, at this stage of vaccination coverage, faster than almost any other country in the world has done. And we shouldn't stop there. We absolutely shouldn't stop there because of what it means for protecting our entire community, those most at risk, and what it means for the freedoms that we can enjoy and being able to not have to take backward steps through the end of this year and into 2022. It really is our ticket through this. We all want to get out of lockdown and We've got that slated properly for the 21st of this month. But we will get to 80% double dose. I reckon we'll do it in record time. We're absolutely powering through. Most of the vaccinations given just a few weeks ago were dose 1. We've now got 38,000 plus people who got vaccinated in our state-run centres, and more than 32,000 of those were second doses. Many of those are in our younger age groups, which is really critical because they've got a bit more to go in terms of getting that higher coverage. So if you haven't booked your second dose, please book in today, and it'll help us to open up as we hit those thresholds. The reality is a lot of people are going to get exposed to COVID-19 in coming months as many people move around the state, as many people interact in all of those places that are opening up. A lot of those people will have mild illness, asymptomatic illness, and you won't know that the person that you're standing next to has COVID-19. So we really have to protect everyone, and on the basis that we are opening up and that we will have those exposures. It might sound confronting, but it's going to be much more manageable, and the modelling tells us that with that very high vaccination coverage, our health system, which will continue to have significant challenges, but it will cope. But please protect yourselves. It's the individuals who are unvaccinated or not fully vaccinated that I'm still concerned for. If you've got those concerns, please speak to your GP. Please speak to a pharmacist or nurse immuniser about any of those concerns, because I do not want people to go through the rest of this year and into 2022 remaining vulnerable. Whether it's a GP, pharmacy, a state-run centre, or a pop-up or a mini-pop that you've stumbled upon, doesn't matter. Please just get vaccinated. Let's bring this home, get your second dose, and help us get to that 80 and 90% double dose mark and be an absolute global leader in our vaccination coverage and in the protection of all Victorians. My thanks to everyone. It has been an extraordinary challenge, but haven't we done well to get to this point? And we are heading for even better days ahead. Thanks, Premier.
Thanks very much, Brett. I did, I think, promise to talk about the unification of these rules, but I neglected to do so. Once we get to 80%, the roadmap is very clear. We have the same rules across the state. We have freedom of movement across the state. The biggest variable there is when we get to that mark, and that's all about people going and getting their first and second dose appointments. And to that end, we're on the phone ringing people who have got a second dose appointment coming up, urging them to go and bring that forward if they can, and certainly urging them to make sure that they book their appointment and turn up and be part of that 80% number. Happy to take any questions you have with the usual rider that any further detail that we need to take on notice about rule changes. Of course, these rules don't change until Thursday night. We're more than happy to do that offline and come back to you.
What's the situation with masks, Premier?
Masks remain unchanged as per the roadmap.
Will that change at 80% that masks would go outdoors?
The roadmap indicates that, yes.
In terms of regional versus metros, a lot of people obviously wanting to cross into either. A lot of people from
regional. If you have a permitted reason, if you're working or caregiving or those sorts of things, then of course the same freedom of movement applies. We haven't changed that. But what we're giving to people, because they've got vaccinated in such amazing numbers, we're giving people a freedom of movement across metropolitan Melbourne. What we don't want at 70% double dose is to have people making unnecessary, perfectly reasonable, and I know why people want to go to regional Victoria, but if it's not an absolutely necessary trip, we don't want people at 70% double dose taking the virus into regional Victoria. Once we get to 80, it's to that point that we've both made, I think, this morning, that there is the world of difference between 80% protection and 70%. So that can change, but it's just not quite right now. We don't want to be spreading the virus until we have got to that 80% mark. So it's only going to be sort of, well, we would think this coming Thursday, not that weekend, but the weekend after, probably at the outside Cup Day. We think it may even be earlier than that.
The same rationale then for not allowing people from regional Victoria into Melbourne?
Yeah, so there are rules at the moment, and if you've got good reason and you've got authorisation to be moving, you can still. That hasn't changed, but we just don't think that it is appropriate at this point. But again, give it 10 days and it'll change. But the advice is, and the modelling demonstrates, and it's back to that key point, if we were to do everything that the roadmap talks about us doing at 80% at 70, then you finish up with a very bad outcome. We're doing everything we can, all of us, every single Victorian, I think. Certainly the vast majority, we're all doing everything we can to avoid that.
This essentially means that someone from New South Wales, if they've got a legitimate reason, will be able to travel to regional Victoria, but someone from Melbourne won't. Is that a recognition that you're more likely to have COVID if you're in Melbourne than you do the
Yeah, because that's what the case numbers tell us. That's what the case numbers tell us.
That travel limit's scrapped. Does that mean that Melbournians can fly to Sydney for a holiday, for example?
Well, whether you can get into Sydney or not would be a matter for the New South Wales government, not really a matter for us. But at this stage, what I'm asking people to do and what they'll be required to do, it was going to be no visitors to your home. Now you can have 10, including kids, but not little bubs, per day, because that's a safe adjustment for us to make. You can move 15 kilometres now. It was going to go to 25 kilometres. We've decided no, you can move across metropolitan Melbourne. But you can't go to regional Victoria unless you've got good reason and an authorised reason. And that's only for a 10-day period or so, just while we get the numbers from 70 to 80. So these are meaningful. They're not small things. They're quite substantial changes, and they'll see a lot of people able to access the things that they have missed the most, the things that they've longed for the most. As someone who's got family 250 kilometres away from where I live, it won't mean that I can see my family, but 10 days later, I'll be able to do that. Now I know there'll be a lot of people that are in that circumstance, and they'll be upset about that. You've got to take the steps you can safely take, and you've got to follow the advice of the experts. And the modelling says if you try to do all the 80 stuff at 70, you don't get a good outcome. If we just can find our way to keep getting vaccinated, get to the 80% before Cup Day probably, then we have every reason to be hopeful, every reason to be absolutely confident about what the next few months hold.
Gyms are currently 5 people outdoors. There's no mention of any change there. Is that the case? It's not.
No, the only changes to the roadmap are the ones that I've read out. The rest of the roadmap stands.
Can you understand why there might be some in the industry, if you can have 10 to your house but only
Yes.
5 and not inside, why they would be confused by that?
This is the thing. And if you try to do everything at 80, at 70, then just the cumulative amount of movement, the cumulative amount of activity, and no doubt, there'll be some who are displeased with elements of this. But let's be really clear. Today is a day where every Victorian should be proud, and every Victorian should know that I am grateful, the government is grateful, and we can be optimistic and positive about what's been achieved here. It is absolutely amazing to be this closely aligned to New South Wales, to be only just a couple of weeks behind New South Wales, when we know and understand just how much extra vaccine went there, is a credit to every single Victorian. As I said, conviction, compassion, and an absolute determination to get this done. And that's what Victorians have been able to achieve. Now, there is just a little way to go, and we've got to finish it off. But I'm absolutely certain Victorians will do that.
I know there's only 10 days difference between 70% double dose and 80% double dose.
We certainly hope so, yes.
The Burnett modelling we have, I guess it models for moving the 80% step to 70%
Yes.
step. So all of the 80% at 70%.
Yes.
Given that's not happening at the moment, is there can we get a bit more of a, I guess, what does the trajectory show essentially in terms of ICU demand, hospitalisation demand? Because I'm assuming it's not.
Sure, we're more than happy to come back to you on all of those matters. That might even be, if you want another briefing like you had this morning, more than happy to arrange it. Part of it as well, and look, this is a good problem to have. The forecasts, the assumptions, had more people in hospital, more people gravely ill in hospital, and more people staying longer in hospital. This is the point that we've made probably 1,000 times, and we all understand this. Modelling is just that. It's your best endeavours with all the different inputs to predict what's going to happen. Actuals, what did in fact happen, as every day passes, is obviously much more valuable. It's good for us to be able to look at these numbers. That's not to diminish the fact that 777 people are in hospital, and many of them are very unwell, and the staff who are caring for them are under a lot of pressure. But those numbers are better than we thought they would be. So that's a wholly good thing. But if you want further briefings on what we think the trajectory is, and they'll be relevant for a period of time, then they'll be replaced with the actuals and become less relevant. But we're more than happy to arrange that. We've done that all the way through.
Is there any difference between 70% and 80% is only 10 days, but throughout the whole pandemic, we've, obviously indoor visits has been the most dangerous. Yes. I guess, are you concerned about how much pressure allowing indoor visits might put on our healthcare system?
Well, what I'd say is this: this is a fundamental agreement that we have with the Victorian community. You get vaccinated, we will open up, and if we can go further, we will. And that's what today is. Because people have got vaccinated in record numbers in record time, so 5 million people have had at least one dose. We are not just 5 days ahead of 70%, we're more than that, in fact, ahead of 80%, we think. It's just been an amazing effort, a stunning effort, and Victorians should be proud, and I'm proud of them for what they've achieved. We do have to finish it off, though. No one's sort of calling time on this. If you've got a second appointment, make sure you turn up. If you can bring it forward, please do so. If you haven't made a first dose appointment yet, book one. There are plenty of them available, and as I said before, 97%, so pretty well everybody who's in ICU is not fully vaccinated. That's the number that matters the most, and that's the biggest and best reason. Whatever motivates you beyond that, whether it's protecting yourself, your loved ones, getting your freedom back, opening the place up, whatever motivates you, please go and get vaccinated, because you are at a tiny fraction of the risk of getting really, really sick if you've had 2 doses.
Premier, we've talked a lot. Premier, we've talked a lot about 70% and 80%. We're now on track to exceed 90%.
We are, yes.
Do you think that is actually going to change the way that Victoria lives with the virus long term?
I think it will. I think that when you get to 90%, and look, and I don't think it'll just stop at 90%. It's not like a ceiling. I think it'll creep beyond that. It'll maybe get to 92, 93, 94% even. Every jab, every person, every percentage point that's fully vaccinated, that is literally tens of thousands of people less getting sick and finishing up needing hospitalisation. It will absolutely impact not just what the peak when you open looks like, but what next year looks like. Because what we know is that if you are fully vaccinated, you have absolute, well, not absolute, but you have considerable protection, really strong protection against becoming really, really unwell. You may get the virus. You may have particularly mild symptoms. You may not even know you have the virus. You're at less risk of getting it, though. You're at less risk of giving it. And if you do happen to get it, you're at vastly reduced risk of finishing up really, really unwell. And that will be enduring. The point here is this. I think some of the positive numbers we're seeing in hospital, so reduced length of stay, less people finishing up in hospital for a shorter period of time and being less unwell, is a function of the fact that the pandemic of the unvaccinated is becoming a smaller and smaller group. It tends younger, both because of access they were the last ones into the program. They're also the most mobile people. But if you flip that around, when we get to boosters next year, we've got exactly the opposite problem. Rachel and I were discussing this earlier in the week, that you've got people who are perhaps the most vulnerable, they're getting close to needing their booster shots. But that's a problem, that's a challenge for another day. The point I'm making is that this is far from over, but these freedoms, these announcements today are a credit, an outstanding credit to every single Victorian who has done what we've asked of them. I am proud of them, I am grateful to them, and that's why we're able to make these announcements today.
What's the rationale for allowing indoor hospitality but not indoor retail, particularly given that if you're a small shop, you might only need to have 2 or 3 customers as opposed to 20 if you're hospitality?
So the first thing is for about 10 days. So this is not some indefinite thing. It's for about 10 days. And it goes back to that central point. If you did everything at 80, at 70, which is, and for instance, opening up retail is not something that was ever countenanced until 80. We just finish up with too much movement, too many cases, too many people becoming too sick, and then it gets really, really challenging. And look, and I'm sorry that when you do more, you can't do everything. We're doing some things. We've tried to be balanced. We've tried to be as fair as possible. But whenever you draw lines, whenever you write lists, there will always be some people who are either on the wrong side of the line or not on the list, and I get that. I suppose we know and understand that it's not, and I would ask everyone to know and understand that it's not indefinite. It's about 10 days. And I know that'll be difficult for a lot of people, but if we had everything open, that's not 70%, that's in fact 80%. And we're still 10% to be covered with their second dose, and even more than that. It's just not possible for us to do that.
Given that international travel could open up in New South Wales before we hit the 80% double dosed mark, how come there's no mention on here about how, I guess, international arrivals will work into our roadmap?
Well, with no disrespect to my colleagues in New South Wales, I'm not here to make announcements about the issuance of visas and passports. I don't control the international borders. I think the federal government have politely pointed that out to the New South Wales government as well. But in any event, I think we'll have a National Cabinet meeting quite soon, and we'll have a chat about all of those issues. We want to get the place open as fast as we can. Quarantine's absolutely changing. I think we're going to see much more home-based quarantine. We're going to, particularly for people who've had the tests, they've got 2 jabs, they're at a vastly reduced risk. And once we're open, we're not trying to keep it at 0. Like, we're in a different phase, a fundamentally different phase. So we will see international flights arrive in Melbourne and not go to a hotel quarantine. They will instead go home for a period of time, and it won't be 14 days. I think it'll be less than that. They might have to get some tests done. They have to be vaccinated, of course. So the rules will be different, just like they are to go to the pub. They'll be different when it comes to what sort of quarantine you have to do. But I think we'd all be well served by a National Cabinet discussion, which I think will happen quite soon, where we can talk about all these issues and perhaps have some clarity. The other issue too is that, I think Victoria will be very much aligned with New South Wales when it comes to flights coming in, people coming here for all sorts of different reasons. Because, of course, in my discussions with Dominic, we want to have our borders open. We want to operate in some respects as one zone. Other states are not indicating that they're going to have their borders open. So I think you'll finish up with the East Coast, that is to say New South Wales and Victoria, much more closely aligned when it comes to international arrivals.
So even we're on the topic of in Sydney from overseas from November 1, will Victoria be requiring them to do any kind of quarantine to then travel to Victoria?
Well, I think it'll depend on whether they are vaccinated or not. That's the first issue. Clearly, the New South Wales government have, and look, and this is not sort of brand new. Gladys had made some similar comments, at least privately, at National Cabinet, letting colleagues know that she didn't intend to be continuing to hotel quarantine people from Melbourne or Perth or Brisbane or wherever in Sydney. So I think that we will finish up with a home-based quarantine system that looks very different to the hotel quarantine system we've had. And what I'm trying to achieve, and what I think all of us want to try and achieve, is as consistent arrangements as possible. And New South Wales and Victoria are going to be in very different position than some other states, which will be closed to Aussies and closed to people coming from overseas. That's entirely a matter for them. They're not going to be in our position. They're not going to be at the vaccination rates we're at, and they're going to be still chasing COVID 0.
So fully vaccinated people arriving in New South Wales from November 1 won't be required to do even home quarantine. Will you require those people to do home quarantine if they then want to travel on to Victoria?
Sure, that's to be determined. And I'm not here to make any announcements about the borders or about those matters. What I think we're best served to do is to have a National Cabinet discussion and try and work that through. But we want the least impactful thing possible. Like we don't want to be putting any more burden on them than we absolutely have to. And the whole thing changes when we've reached a peak vax number and the people coming here have got 2 doses. We have many, many more options.
Would you be concerned that if you did continue to impose that home quarantine requirement in Victoria when New South Wales is not, it would create an incentive for people to give them to travel to Sydney and give them their money rather than coming to Melbourne?
Well, I'm always interested in economic development and as much activity as possible in our state, not in other states. We wish them well, but we're not looking to be at a disadvantage for anything. But that's why I think it's just really important to acknowledge, there'll be some out there saying, well, why can't we be where Sydney is? on rules and things. Yeah, they're at 80%. We're not. We're about to be at 70%. They ticked over 80%, I think, yesterday. Their rules change tomorrow. And we all know why they're at 80%. And, you know, none of us can change that. But we're going to get there really, really soon. And once we do, we'll be able to have the roadmap delivered in full. And indeed, we may even be able to go beyond that, because it's not going to just stop at 80. What we know is that if you've got 90% of people with one dose, 99.99% of them will come back and get their second dose, which means we're not going to get 80. We're going to be well above that. And that'll give us all sorts of options that we could only ever kind of speculate or perhaps hope for when we were at 20 and 30 and 40 and 50%. The growth has been phenomenal. That's why we're so proud and grateful to every single Victorian, all 5 million people that have had one dose at least, and I'd encourage that number to continue to grow.
Premier, you've talked about the danger of moving the roadmap from 80% to 70%.
Yep.
But the Burnett modelling that you gave us actually models that, and their numbers for hospitalisation and deaths actually come in below the numbers that they modelled for your original roadmap reopening. So they're saying it's actually safer than what we'd planned to do all along.
Yes, but but hang on, but not might be safer than their original modelling, because as I've said, there's a whole range of assumptions that have turned out they're a bit on the conservative side, but not safer than what we're actually doing. So we've given some, we've made some changes, we've made some adjustments where we can do that safely. Can we pretend that 70% is the same as 80%? The answer from the scientists, the answer from the doctors, the answer from the mathematician modellers, and just the answer, like common sense just tells you, 70 and 80 are different. If they were the same, well then the national plan would say that the settings should be the same. The national plan doesn't say that, and our roadmap to deliver the national plan doesn't say that. So the key point here is to, where you can, go further. And sadly, that doesn't mean you can go further everywhere. You do have to make some very difficult choices. And if it was a much longer period between 70 and 80, then maybe some of these choices would have been different. But it is, we think, about 10 days. It could even be less than that. And every single person who comes and brings forward their second dose appointment will help us to get to that 80% even faster.
On your earlier point,
roadmap, is contingent on 70 or 80% of the over 16 population that's been vaccinated.
Yes.
In order to have 30 visitors to your home, we need 80% of the 12 and over population. What percentage of 12 and over, 12 to
I'll get you an exact number from today, but we are very confident. So just to be clear, so no one is confused in any way, the 30 visitors to the home is basically Christmas, and we hope some weeks before Christmas. In terms of the 12, 13, 14 and 15-year-olds, it's been amazing, the uptake. They are hot on the heels of every other age group. And we think that the 80% 16 and over and the 80% 12 and over may only be a day or two apart. So essentially, Samaya, we may well collapse those things together. We may consider that having been achieved, because it's only a day or so later.
So just to confirm then, if we get to 80% of the 12 and over population vaccinated, I don't know, around 6th or 7th of November, for example, a couple of days after, we will be able to have 30 visitors to the home, or will you push that back?
Well, not necessarily on that day.
Yep.
Not necessarily on that day. But I'm not here to make any announcements about 80%, other than to say we're on track. I think today shows you that where we can go further, then we're minded to do that. But it's got to be based on advice. It's got to be based on modelling, and sadly, it can't. We just, again, I just say to every single person who's listening and watching, and I think Victorians are smart. Victorians get it. 80%'s not 70, and you can't. 70%'s not 80, and you can't just assume and pretend that it is. Because if you do, then you've got literally hundreds of thousands of people who are not protected. They haven't got a second dose yet, and they are at greater risk of becoming unwell. They're at greater risk also of spreading it to many other people who haven't had a chance to have a first dose yet. But we're getting very close, can I say, to anyone who wants a vaccine's had an opportunity to get one. So that is a thing, and that's why we're moving from lockdowns to lockouts. I'm not going to lock people down to protect people who won't protect themselves. So I just encourage people, for every good reason, do what 5 million other Victorians have done. Go and get your first dose, and then get your second dose thereafter.
Schools, If you're a student who lives in metropolitan Melbourne
Yes.
but goes to school in regional Victoria, vice versa,
We will have some specific advice for those students, and we're happy to confirm for you what we're going to do. We know and understand there are some people, and this has been the case with some of the, for instance, Mitchell Shire being locked down for a period of time, some other sort of peri-urban interface areas where, as you say, families live on one side of the line, but kids go to school on the other side. We'll have specific arrangements for them.
This might be one more for the Chief Health Officer, but we're opening this time around with more cases than we've ever had before.
Yep.
Are we changing the requirements around, say a business, a pub,
Sure.
has a positive case visit, do they have to close?
We
for
will
a
have
2
more to
weeks?
say very soon, the next couple of days. We've made some decisions. We're just working out the finer details of those things, but there's been a lot of work done in recent days about furloughing, a lot of work done around what does it mean for primary close contacts in this, highly vaccinated world, and this phase. So we'll have some more announcements on exactly those matters very, very soon.
It will be different to what we have right
Correct.
now, though.
A lot of Melburnians will be thinking, where can I go next weekend? I can get out, I can have a weekend away, and for a lot of people that would be the Mornington Peninsula. Would you expect a flood of people down there to cause a spike in cases?
No, I think if people are sensible, if people are moving around and are accessing the vaccinated economy because they are double dose, then they're at much less risk of contributing to more cases. But we are going to see more cases. Case numbers are not going to be anywhere near as important as they have been, because we now have the thing we've never had, and that is 70% of the community, 16 and over, and in effect 70% 12 and over, have got not one dose but two, and 90%, so 9 in 10, have got one dose. And they're all going to get their second dose, and that means the missing thing, the thing that's never been there. So why have we had lockdowns? Because we didn't have a vaccine. Why have we had rules and density limits and all manner of quite unimaginable restrictions on people's lives? Because we didn't have a vaccine. We now have the vaccine. Victorians, to their credit, to their absolute credit, have in record numbers and in record time gone and got vaccinated. That makes all this possible.
Is there another trigger then for another lockdown, or is this it? Is this the last?
Well, no.
lockdown?
The roadmap does speak about, and the national plan speaks about, there is potential for a very targeted measure if you had a particularly vulnerable community where, say, vaccination rates were very low. Then there is, in the national plan, the national cabinet plan, there is the prospect of something that's quite focused, something that's quite targeted. But state, no. We're moving this today. We are moving beyond that. So we're not locking people down anymore across the board. We're instead locking people out who have not got vaccinated to protect themselves and to protect everybody else. They're not going to be able to participate in the economy and the community the way that they would like to, and that's the way that it has to be. I just say to people, it's within your, not for those who can't get vaccinated, I stress. If you've got a medical issue and you can't get vaccinated, that's not including them. But for people who've made a choice, and I respectfully say it's the wrong choice, get vaccinated. Don't be one of the people in ICU. Get vaccinated.
And if I have 10 at my house, can I hug them? Can I kiss them if we're all vaccinated? What's the recommendation?
Well, I might ask the Chief Health Officer to speak to these matters of personal contact. No, look, I think we'd ask people to be, we would ask people to be conscious of the fact that there is a global pandemic on. But if you are fully vaccinated, then you, I think, can behave as normal as you would, perhaps more normally than you have for a very, very long time.
Are there any restrictions on how many houses you can visit? So, for example, can someone go to a person's house for an hour and then another person's house, provided those people haven't had more than 10 guests?
I just ask people to use common sense. So, no, we're not kind of, trying to limit where you might go. But, if I come to your house, then I count as one of the 10 people who can go to your house on that day. And again, why do we need to do this? Well, because we're at 70, we're not at 80. And, indoors is more dangerous than outdoors. But because we've got that thing we haven't had, we've got 70% people double dosed, and very soon thereafter 80%, we have options. We have many more options, things we haven't had for what seems like the longest time.
For those looking forward,
you absolutely can ask him whatever you want to ask him, but do you want to finish with me first?
Yeah, I've just got a few more for you.
Sure,
for those
no worries.
Halloween lovers, does this mean that trick-or-treaters can door knock now that...
I understood we were doing a kind of click and collect Halloween this year. I think you can go to the front of the property, but don't enter the property, don't knock on the door. So it's that type of stuff. There are some arrangements. They're based on common sense. I know I stumbled on this last year and didn't really have any awareness of the event, but I'm happy to say we've made a lot of progress since then, and I'm happy to confirm things for you.
100,000 unemployed after the longest lockdowns. Do you have any view about what happens after the lockdown finished? I mean, we had the largest unemployment figure out of any other state that was announced.
Well, we've got a plan for jobs. It was detailed in not one but two state budgets in unprecedented terms. And we'll roll that out with the same level of passion and commitment that we have rolled out the vaccines. And everyone will play their part, and everyone will see a return to growth and prosperity. There's healing to be done, be in no doubt about that. This global pandemic has been particularly hard on all of us across not just our state but our nation. And we need to work hard to repair that damage and to rebuild, and we will absolutely do that.
You're confident we'll be where we were pre-pandemic?
I am. Well, I'll put it to you this way. It won't be for a lack of trying on our part. And I think businesses will rise to that occasion. I think that workers, people across the board, we're about to become one of the most highly vaccinated communities anywhere in the world. That means that can be a competitive advantage for us. One of many. We had many before the pandemic, and we will. Victorians have shown themselves to be resilient and tough, absolutely committed, but also compassionate to each other, kind to each other. And I think people will work together to achieve all those things and more.
Do you see a return to migration numbers as we had? I mean, we're fairly dependent. I mean, we've had 43,000 people leave Victoria.
That's you know my long-term position in terms of migration matters. That hasn't changed. But who comes here is a matter for the Commonwealth Government.
What's the framework for events?
Events, yes. Now, I probably should have mentioned events. We will be able to give people much greater clarity in just a few weeks' time, once we get to the 80% mark, about what, not just that week, but what all of summer looks like, what we hope the whole of the summer will look like. Now, we just had great news. The Grand Prix has been confirmed for April. There are many, many events in between now and then, and I would just say to any event organiser, I know it's been a very stressful couple of years, I know it's been really challenging, but please don't be cancelling any events just a little bit longer, and we'll be able to give you the clarity that you need to be able to plan for the rest of the summer. So I'm not being critical of them, I'm just saying just a little bit longer and we'll be able to give you answers to many of the questions that you've been asking, and I think we're going to have a very, very busy summer full of events, large and small, city, suburbs, regions. It's going to be a very busy time.
Will that clarity come?
Well, that clarity will be able to come in the weeks ahead, so just in the next couple of weeks as we get to 80. So once we get to 80, we'll be able to answer all of those questions about what we... So there'll be a few different periods. Here's what we know, so that'll be, say, a month or two, and here's what we expect, once we get a bit further down the track. But we'll be able to give people as much clarity as possible. Can't do that right now, but for instance, I'm sure if many people had said, would you be able to have 3,000, 4,000, 5,000 people at the Music Bowl? Would you be able to have 10,000 people at the Melbourne Cup? Would you be able to have all those 14 or 15 regional vaccinated economy pilots we've got going on in the regions now? If you'd asked us 2 months ago, could we do that? Maybe we wouldn't have been certain. So we'll be able to fill in some of those gaps for people. And I do appreciate it's been really challenging for event organisers, large and small events, some for profit, some just community events, really valuable community events. We will give them more clarity as soon as we can.
I understand, for instance, theatre productions have had financial support, but it's ending when lockdowns end. So
No, we work very closely with, whether it's Moulin Rouge opening up, Hamilton coming here next year, Harry Potter restarting, et cetera, we have worked with them very closely, and we will continue to work with them very closely. And once we have that activity up and running again at 80, It may well be for safety's sake we can't let them have, as the roadmap talks about, a full theatre. So we stand ready to continue to support them because we know how important that is.
Does the support run out for theatre?
Well, what I'm indicating to you is that we continue to work with them and we will stand with them for as long as we need to. It may be different. It may not. If you're open at 50%, you probably don't need the same support as if you're closed. But we'll continue to work with them.
Just to go back to the question around migration.
Sure.
The New South Wales Premier and also business leaders, they've been calling for an even bigger migration program than what we've seen. What are your views on that?
I think we need to look at what some people have used the term snapback. It's not one that I use myself, but we have to wait and see how quickly we can, from an economic point of view, and employment, investment, how quickly can we see a return to something approaching normal? Some of those factors would have to be part of this, but we've had, without getting into an economics debate, but our economic growth is attributable to a number of different factors. It's not just one factor, and arguably our state, because we don't dig money out of the ground like some other states do, that more complex economic growth is perhaps more dependent on things like international students. That's not necessarily a migration issue, but all of these matters, I'd be confident that the Commonwealth Government will take into account all of those issues, and you wouldn't want to put more strain in certain areas, but you also wouldn't want to starve other areas of the fuel that they need, and that comes from more people coming here and spending and investing. So it's a good deal more complicated than it sometimes seems, and I think more so here than in some other states. But no doubt the Commonwealth Government will look at that.
Speaking of international students, the government announced just a week or two ago that it's going to charge universities thousands of dollars per student for students to come here and quarantine. Is that system basically going to be superseded by the New South Wales announcement the other day? If students could go to Sydney and not have to pay that money, why wouldn't universities go to New South Wales?
No, I'm not finding fault with your conclusion, but please don't be in any doubt. Nothing's superseded by what New South Wales does. Like, we're working on all of these issues and 100 more, and have been for months. So we will have quarantine in a vaccinated economy and a vaccinated community looks very, very different. One of the most important developments on this exact issue, given the number of students who will have received a Sinovax, the fact that that's now been recognised and is on the list is incredibly important for us, all of us, but I would argue Victoria more than most, given the sheer number of students who I think will be in that category. So, yeah, it's not a matter of being superseded by anybody. It's going to change, and I think we've been pretty clear about that. We're not going to be running hotel quarantine for a moment longer than we need to. But there will be some people who are not vaccinated and who have a right of return because they're an Australian citizen or they're a permanent resident. There will then be, I think it's highly unlikely that students or business visas or tourists will get in here without being double jab vaxxed. I think that's very, very unlikely. Again, not a matter for me, a matter for the Commonwealth, but I think that would be highly, highly unlikely.
Is Mickleham going to be a white elephant before it's even
built? No, I saw a bit of commentary about this, and I'm not here today to, reflect on, some of the commentary yesterday, or to reflect on my good friends in the federal government. Today's a very positive day. Today's a positive day, and it's not about them, it's about what Victorians have done. But I would just say this. We didn't have Mickleham at the beginning of this pandemic. We will have Mickleham at the beginning of the next one, whenever that might be. We will have Mickleham when next there is a massive bushfire event and we need somewhere to put hundreds and hundreds of people who've lost their homes. We will have Mickleham for all sorts of reasons. And we'll have Mickleham in just a few months for people who come back here and are not vaccinated. Or when another variant pops up, we will have Mickleham. So I think it is a very good investment, and I would just make the point, we're going to run it, but the Commonwealth are building it. The Victorian taxpayers are not building it. It's the Commonwealth that are building it and paying for it, and it's on their land. But we'd have all been better off if we had it 2 years ago. We didn't. Can't change that, other than getting on and building it now. So we stand ready to run it for whatever cohort, in whatever circumstances it needs to be used.
Just on your earlier point about events, do you expect to have 100,000 people at the G for the Richmond-Carlton match
100,000?
When do you expect all restrictions will go?
I can't be certain.
Is there a particular threshold that you want to see?
I can't be certain right now because that is some way off, obviously, and I want to see crowds of absolute significance at the G as soon as we possibly can.
Today's announcement will obviously give Victorians a bit of hope. What's your advice, I guess, for people that want to book holidays interstate, internationally for Christmas, New Year's?
Yeah, I would. On international travel, I think I'd wait and just see things firm up a little bit about what the quarantine requirements will be on the way home. Plus, the other thing too is the borders are shut. You can't leave without a federal government approval at the moment, so you would have to wait. In terms of interstate holidays, with the greatest of respect, I'd encourage people to holiday here. If you are intent to go for the best of reasons to another state, then first thing to do, get your first dose. Second thing to do, get your second dose, and then you'll have many, many more options.
Can I just also really quickly run through the return to school and clarify what's happening there?
You can certainly try. I don't have it in front of me. The only change, right? It's the school roadmap brought forward because the end of lockdown has been brought forward. As I understand it, that is the only change we've made.
So will all students be back to school full time at 80%, regardless of the day?
I don't have the roadmap in front of me. There's all students for at least part of the week will be. I think that's the position, but it is staggered. And I would just say on this point, parents have done an amazing job. Teachers and school staff have done an amazing job. Kids have done an amazing job. But I've had quite a bit of feedback that because kids have been out of the classroom for so long, the notion of a staggered start back, many people have said to me, in lots of different settings, many people have said to me that they think that is a good thing. Sort of easing our kids back in, because for some, particularly our smaller kids, they haven't had the socialisation, they haven't had the normal experiences. But look, to that end, we will get through that. Some of the announcements that the Deputy Premier made the other day about more mental health support, tutors being rolled over for another year, they've been outstanding, thousands of them supporting kids, and we'll have more to say about how we support our kids too, in the classroom and outside the classroom, things around socialisation and kind of catching up on those things that they've missed. If you've got any specific issues about the education roadmap, I'm happy to come back to you.
This might be as much for Brett as it is for you, but was there any pushback from health authorities when you decided to bring some of these things forward? No.
We had a series of meetings and discussions, and we were able to agree last night. CMC met last night, late in the afternoon yesterday, to confirm. That's the way it normally works. You wait for the latest data, you wait till the last possible moment, because that gives you the most complete picture. But I think I'd given a very clear indication late this week at the back of Parliament that this is an agreement. We've asked Victorians to get vaccinated. They've done that. A little bit more to go, but they've done it in record terms, in record numbers and in record time. That always gives us more options, and we have used some of those additional options. But it's not 80% yet, and we can't do everything that others are doing. So, Sydney's at 80%. Their settings are different. We're not at 80%. We're about to be at 70%. But no, we work very, very closely together to get what I think is a very good outcome for our state, and one that only gets better as more and more people get vaccinated in the coming days and weeks.
Will the CHO's current powers under the Act also go back to normal after we get the 80%, or will the Chief Health Officer still have the same level of power even after we get up?
That's not a matter of the vaccination rates. That's a matter of the Public Health and Wellbeing Act, the state of emergency. And as you know, there is a need for us, because there's no further extensions. There's a need for us to rewrite that act into pandemic-specific ledge, and we've committed to do that. And that process will unfold in coming weeks.
Can we ask Professor Sutton a couple of questions?
Yeah, absolutely can. I'm waiting for you to be finished with me.
This might be for Brett as well, but there are reports today that
I'm happy to wait as long as you want. But
reports today that there are major hospitals weighing up whether to close down their paediatric wards and sending all children to the Royal Children's or Monash Children's, so they can better cope with adult patients. Do you support that plan? Do you have concerns?
I wouldn't comment on that specific plan because I don't know what the status of that plan is, but we've been very clear and the easiest thing is for people to find fault with decisions that hospitals make. But let's be really clear about this. Hospital administrators, doctors, nurses, AMBOs, the whole team, the Department of Health, everybody across the board, they'll make the best decisions so that the sickest patients get treated quickest. That's how our public and indeed our private hospital systems work, but tending a bit more toward the public. We do that really time-sensitive work. That's our job. We are the front door for all of those people. So we don't want to see people having to wait longer than would be clinically recommended. We don't want to see people disrupted. We want to get through this. We want to provide everybody who needs care with the best care possible, as close to home in as timely a fashion as we can. That's not just a job for the government though. We can all play a part in that by getting vaccinated, by bringing forward a second dose appointment, having your first dose appointment, not just talking about it or thinking about it with your family and friends, going and doing it, booking that appointment. There are tens of thousands available. So it's one of those rare things where even stuff that you don't see, even stuff that you may never be anywhere near, you can influence what happens. You can absolutely influence what happens by turning up and getting vaccinated and becoming part of that 80%, 85, 90, who knows, maybe even 95%.
Are we looking at creating streamlined hospitals for emergencies that aren't related to COVID?
Well, we have streaming at the moment for COVID patients. So I suppose you could say that the flip of that is that we're streaming for other patients as well, because there's a priority. We're not having COVID patients in a whole bunch of settings. We will make adjustments where we need to provide the best care to those who need it. I would just say that is not a function of money. That's not a function of machines. It's not a function of we don't have the tubes and wires. We don't have the PPE. We've got all that. We've got all of that stuff. What it's a function of is we have, machines don't treat patients. People treat patients, nurses and doctors, and they're tired. They're very tired because they've had, 20 months like no one's ever had. So they're doing a great job, and I'm very proud of them too, and grateful to them as well. But the system needs to look different because the priorities are different, because we've got all these people who are critically ill. They need to be at the top of the queue. They need to be treated first, and that means that other people, I'm sorry to say, they may have to wait a little longer for some of the things that they need, but we'll support them as well. That's why it's a system. It's not just services, it's a system. And indeed, I want to thank our private hospital colleagues as well, who are working with us very, very closely together as one system, if you like. That's how we get the best outcomes for patients.
Do you have any data on how many exemptions have been granted, vaccination exemptions?
No, I don't. I don't think the CHO would have either. That'd be a matter for the Australian Immunisation Registry. So the AIR data, and if it's that, it would be. I think that database, that GPs would, if they signed the exemption, they would plug that into the AIR system. So I think the federal government might be the people to be able to give you that answer.
Can we ask Professor Sutton a bit more about
You can ask him as many questions as you like. No more for me? Very good.
Thank you very much.
So Professor Sutton, so far we've been told this is happening early because vaccination is going well and the length of stay in hospital isn't as long as the original modelling anticipated. Is that why this is happening?
Yes, it is. What other answer are you expecting?
Well, just to expand on that a little bit, like, are people not staying in hospital as long because they're getting better and Delta isn't as bad as we thought it was in terms of severity?
I mean, we've looked at where hospitalisations have been tracking against the vaccination coverage, and the recalibrations in the modelling are really looking at what the length of stay has been shown to be, and indeed what the magnitude of the impact of that vaccination coverage is doing to hospitalisations and ICU admissions, and it looks better than had been originally modelled. And so the projections out for the next couple of months are better than had been originally modelled, and that's a vaccine effect, and we've just got a better understanding of exactly how good that is, and I think that's encouraging.
I'll tell you the numbers of that. So we've seen the peaks being modelled as a little bit earlier than what we previously were thinking. Can you sort of give us an idea of what those numbers are though, and the same goes with the hospitalisations? Where are we still looking at the peak of the number of people who end up in a hospital bed?
I mean, the peak in hospitalisations will still be close to 1,000, and you've got the modelling in front of you, but the ICU capacity is already substantial. It's already a third of our normal capacity. So it's not to say it's not a strain on the system, it's not to say that it's enormously challenging, but it does look better in terms of how stable that is through November, December. It's not going to get up to the 500, 600 ICU beds, which would represent our entire ICU capacity through those months. So it is more manageable in that sense through the next couple of months, and it's likely to stabilise 2 to 3 weeks after this peak, and maybe we've had our peak already, maybe we haven't, but we're pretty damn close if we're not there already. And if there are further peaks as we open up through November, the ICU won't spike as much by virtue of that greater and greater vaccination coverage. And as I say, every unvaccinated person, especially over 50 years of age, every unvaccinated person who we can push into that vaccinated category is less pressure on that hospital system. That's the real difference going through November, December. Equally, booster doses may make a difference. We haven't got a recommendation on that more broadly yet, but we'll have that in the first week of November, and that's something that we would also like to roll out as comprehensively and as quickly as we can, because that will also be an additional protection. The data on booster doses now is that it's a really substantial uplift in your immunity, and it may be good for years, it may be good for life. So we shouldn't discount that from being able to impact some of those hospitalisation figures.
As the Premier sort of noted earlier, as we increase our vaccination rate, the number of COVID cases becomes a bit less relevant because there's a lot more immunity. But I guess, with the Doherty reopening plan, and again, with, your plans earlier on, we've always wanted as few cases as possible. That would obviously logically, push the pressure on the hospitals downwards. Can you maybe walk us through, and I know there are some obvious explanations of Delta's more virulent, there's, lockdown fatigue, but at this point in their vaccination rate, New South Wales saw a downward trajectory in their peak. Can you, just reflecting on, just looking back at our experience, why we're still seeing case numbers so high and what might have contributed to that?
Certainly, we're at a shorter point in our lockdown. Our lockdown's been shorter than the equivalent New South Wales lockdown from time of commencement to time of reaching a point where we could ease the lockdown. So we've gotten to that threshold at the top of our curve, if you like, or very close to it. Equally, and it is related to Victoria's experience through 2020. There is fatigue. There hasn't been the same level of compliance in 2021 as there was in 2020. So that meant our effective reproduction number was a little bit higher right through. I know there's been commentary on, has it just fallen away in recent weeks? That's not the picture from our kind of Google Maps mobility data and various other behavioural survey data, but it has suggested that we haven't gotten to that same level of compliance right through this lockdown. I find that understandable. We're all human beings. We've all struggled against some of those really difficult restrictions, especially seeing other family members. So I think that's part of the explanation for why we've gotten to the high numbers that we've gotten to. That said, and I've reflected on this a lot, pushing that first dose coverage really strongly has made that separation between case numbers overall and daily case numbers and the new hospitalised cases every day, which is a great thing. That said, we want the case numbers to go down as well, because every case number is someone ill, someone needing to isolate, all of their close contacts needing to quarantine, businesses affected, primary care being under pressure, and still the potential to be hospitalised. So it is a significant thing, and we shouldn't ever forget long COVID. There are various estimates about how long the symptoms of long COVID last and what proportion of cases end up with long COVID, but it's not an insignificant burden as well. There are people who carry on with symptoms for weeks and months afterwards, so we want to drive those numbers down as well. But we have to, recognise the fatigue that we've all experienced, and maintaining that social license by recognising that some people have broken those restrictions because they can't tolerate it, and we think that part of the easing up at this juncture and at the 80% juncture won't lead to a huge increase in movement, because it's all been there to some degree, but there is more equity in saying, look, this is an entitlement for everyone in Victoria.
Professor, you've reflected on other jurisdictions in the past, and I understand it's a very challenging position. It's more of a reflection. why couldn't we, and I'm not, in your mind, why couldn't we be like Denmark, which is a similar jurisdiction where people that were vaccinated doubly had more access to freedoms than those that weren't? I just don't understand why that jurisdiction was able to do that so well. I know there might be some cultural differences in relationship to disease and to hospitalisation, but they seem to have been able to not be so restrictive, not go through long lockdowns, and have provided freedom to those double vaccinated that non-vaccinated haven't had. Now they're over the 80% mark and they're completely free. Can you reflect on some of that? I mean, what your view is?
Look, I think it's almost entirely a feature of where they got to with their vaccination coverage. We might have been able to get there 6 months ago, but we couldn't. We didn't have a supply, and we were a real latecomer in global terms amongst OECD countries. That's just how it is. Denmark got to that very high vaccination coverage at a much earlier point in time, and they've stabilised and they're managing their health system by virtue of that.
But they had freedoms at 30 or 35%, those that were double vaccinated. And what I'm asking is why are those who are double vaccinated placed under the same draconian measures as those that are unvaccinated?
No, well, that's not the case as we're going forward. We're talking about a vaccinated economy where there'll be significant access to services and access to entertainment and enjoyment in all kinds of spheres for fully vaccinated individuals.
So prior to that, though, not prior to the 80%.
Well, prior to that, we were dealing with the worst of the Delta wave. Again, Denmark got to a high vaccination coverage as Delta swept through the world and became the predominant variant of concern. Again, we could have and did deal with Alpha and Beta and Kappa through various other stages and beat it back time and time again. Delta was not a variant where that was always had a prospect of success. That's just hugely transmissible virus. ACT couldn't do it. New Zealand couldn't do it with small incursions. Sydney couldn't do it. So that's the reality of a variant that's very transmissible.
The Premier alluded to before that given we're opening with so many more cases, the rules around having to close your business, say if a positive case attends or if you're considered a close contact, are going to change. Can you give us any idea of how flexible you are with bringing that or winding that back?
Oh, we'll absolutely look at it. We recognise the burden. We know that we still have a real pillar of our public health response, which is the quarantine period for vaccinated and unvaccinated individuals, but a vaccinated individual much less likely to develop illness. And most people with the Delta variant are going to test positive within the first 7 days. Very few, maybe 15% only in that second week. So there is an opportunity to shorten that quarantine period. We will look at all of the data around it, what it might mean, but we want the impost on businesses to be proportionate and as little as we can possibly get away with.
There's also a lot of people asking with personal care, so beauty salons and hairdressers, do people need to wear a mask during their service? So things like facials.
Yeah, we can come back to you on that again.
Quick one for the crystal ball. When do you expect that unvaccinated people will again have the same rights as vaccinated people?
I don't have that crystal ball, Paul. You may have access to it, but I don't.
But it will happen?
Look, I imagine it will happen in the fullness of time. I don't know when that is, and I don't expect that it'll be this year.
Not in the foreseeable future.
Not in the foreseeable future, whatever that means.
Given kids under 12 are still vulnerable, unvaccinated, do you have apprehensions or concerns kind of, opening up to this degree, in that landscape? And is there kind of thought going forward to what happens for them as case numbers skyrocket or rise further?
Well, certainly we're still messaging that. So in visits to homes, we're saying, be cognizant of that unvaccinated cohort who are vulnerable. And we do have 25,000 active cases. That's, again, at a different juncture to New South Wales with 5,000 and declining active cases. So we need to keep our kids in mind. In schools in particular, as you've heard many times, lots and lots of layers of protection to manage them. But everyone should have that awareness of the vulnerability of kids. They don't get such significant disease. Certainly they can get COVID and they can pass it on. So the risk to those as yet not vaccinated individuals or people with immunocompromise or other really significant pre-existing conditions remains. And so masks for kids who can wear them and meeting outside and minimising those interactions while we can. is useful advice. But of course the risk is there, but I think we're looking forward to the prospect of a TGA approval for Pfizer for younger kids. That'll come cautiously and conservatively and hopefully be approved, but it's in TGA hands, and it'll probably follow the US FDA approval for that first. We will have more of the safety and efficacy data. I'm looking forward to my 3 kids currently not eligible to have that eligibility for a vaccine in Australia and to be fully protected. But until then, we just need to bear in mind that kids, they're not going to get significantly unwell overwhelmingly, but they certainly can transmit.
Given that, as you say, COVID, a lot of us may well get COVID, would you advise people who might be visiting an older or otherwise more vulnerable person to get a test before they do?
No, not necessarily. Of course, we've always flagged, people who are symptomatic shouldn't be visiting. They should be getting a test and getting that result back. For people who have no symptoms, who are doubly vaccinated, who are visiting a doubly vaccinated person, we just want them to have that normal interaction and start to enjoy those things that we've missed out on for so long and that we're very much looking forward to in the next couple of weeks.
And really quickly on the modelling, given that we always knew that as vaccination rates increased, that cohort of older, more vulnerable people who remained unvaccinated would get smaller and smaller, was it ever realistic for Burnett to predict the numbers of hospitalisations and deaths that they did just a few weeks ago?
Yeah, I think so. I mean, we've been surprised by the vaccination uptake in Australia. There were those who predicted that we would kind of flatten at the 80% double dose mark. The fact that we're getting to 90% with lots of positive indications that it could well be closer to 95% makes a huge difference. Can't underestimate what a difference it makes between 90 and 95%. You're halving the number of completely vulnerable and significantly at-risk individuals. That makes a huge difference to projections for hospitalisation and deaths.
An absolute last one from me. What's the health advice that says that the risk of being unmasked outdoors is higher than the risk of having 10 people over to your house?
No, it's not. Look, outdoors is a lesser risk overall. Always said that. The policing of visits indoors, we're realistic. We want people to be sensible. We want people to enjoy these freedoms as well. We recognise that those interactions are going to be private interactions, but we want people to be sensible about it, and we certainly want people to be fully vaccinated if they're meeting up inside.
What's the rationale for keeping masks outside?
Look, we will drop that requirement at the 80% mark. We still think it has a role to play, both in terms of how much people comply as they move in and out of indoor settings, but overall, there are still opportunities to transmit to others outdoors in close proximity, but it's a lesser risk. We've always recognised that.
Do you have evidence of people actually getting COVID outside?
Yeah, we do. Again, it's hard to quantify because we've got a lot of exposures for people now with all the active cases that we do, but it's known. And the most famous example of the Rose Garden outside the White House with a super spreading event outside is probably a case in point.
I mean, walking alone at night. I was wearing a mask alone.
I'd be confident. I'd be confident that I'd be safe. I reckon you'd be safe as well. All right.
Signing off on the latest kind of further easing of restrictions at Stephanie.
Sorry,
were you at all hesitant with kind of signing off on the latest?
Look, none of it's without risk. We are always balancing really difficult issues and questions here, but treading that line again between social licence and the harms and the difficulties that we know that restrictions impose. And protecting our health system and protecting the health and wellbeing of the population, always been a difficult path. So I never come out of those recommendations with a sense that there's absolute clarity that it's absolutely right. But I think we've always tried to tread a path that balances those competing issues.
Was it ultimately your decision, or was it a collaborative decision that you made with the Premier and the Cabinet?
They're always collaborative decisions in the sense that it's not just my view anyway. It's the entire policy team and the modelling and epidemiology teams inputting for my benefit, and conversations with Cabinet that bring really useful insights in the same way that I get useful insights from the broader departmental view. So there's no question that there are a number of inputs, and there's no question that there are appropriately robust conversations about that. If there weren't, none of us would be doing our job properly.
Just on my, sorry, one more.
Oh.
Earlier Halloween question.
This is the last question. Yeah.
Click and collect. Do you support door knocks, or do you want it to be just click and collect?
Look, if door knocking is the way that you let people know that you've arrived at their front door, great. But I think our recommendation would be that people leave those suites out so that they don't have to have that face-to-face interaction. Again, understanding that we're talking about kids congregating in large numbers here. They are not going to be vaccinated, and 25,000 active cases, some of those absolutely will be young kids. All right.
Thank you all very much.
Thanks all.
Thank you.
Thank you.